This is a study in patients with mantle cell lymphoma, which is a particularly aggressive type of non-Hodgkin's lymphoma. It's a difficult disease to treat. Patients initially respond to chemotherapeutic options, but responses are usually short, and when they relapse, we usually have very few effective options. Ibrutinib is a new type of therapy. It's called a BTK inhibitor. It's an oral therapy which is highly active in the context of relapsed mantle cell lymphoma. About 70% of patients will respond, with few in the way of side effects. So what we've done in this study is do a direct randomized trial between Ibrutinib and another targeted therapy called temsirolimus in the context of relapsed patients with mantle cell lymphoma. The primary endpoint was progression-free survival, and there was a huge benefit in favour of the Ibrutinib arm over the temsirolimus arm. What's interesting, temsirolimus is not a drug that's used in the United States, but it's licensed in Europe for the treatment of mantle cell lymphoma. And the control arm in this study actually performed really very well. So the temsirolimus arm was on a par with what you might see with bortezomib, for example, but a huge benefit in favour of the Ibrutinib arm. And despite patients being on the drug more than 4 times longer than temsirolimus, actually fewer in the way of adverse events, so safe and efficacious. Yeah, so this is a BTK, Bruton's tyrosine kinase inhibitor, and what we know is that's a key part of the signaling pathway for these lymphoma cells. So if you actually target BTK, then you interrupt the signaling pathway, which is what basically tells the cell to stay alive. So that's very specific for the lymphoma cell, doesn't affect normal cells, so this is a very targeted therapy. Treatment of choice for relapsed refractory lymphoma is Ibrutinib. In fact, the most interesting thing of this whole trial, which isn't in the abstract and isn't in the paper, is the last slide I'm going to show tomorrow, which shows that if you use this drug earlier in the piece, patients do much, much better. So the take-home message, if you're going to use Ibrutinib, use it earlier in patients with relapsed mantle cell lymphoma.